New research suggests intermittent fasting is linked to a significantly higher risk of dying from cardiovascular disease, but the research is highly flawed. Chinese researchers found that people who only ate food within an 8-hour window in a day had a 91% higher risk of dying from cardiovascular disease over a median period of 8 years in comparison to people who ate across 12 to 16 hours. Mainstream media quickly circulated the research to scare you, but left out a few key facts. The research has not yet been peer-reviewed or published in an academic journal. The data is only based on a survey collected between 2003 and 2018 from the CDC and was presented at the American Heart Association Scientific Sessions in Chicago. The data looks at 20,000 people who self-reported what they ate for 2 days and then had a follow-up at a median of 8 years later to see if they died from a cardiovascular event. Media outlets including NBC, New York Times, and Washington Post conveniently left out that there were only 31 deaths in the intermittent fasting group, and there is no link with all-cause mortality or cancer. Self-reported food surveys are fundamentally flawed, and you cannot rely on them for accurate data. We don't know what the people ate, how they exercised, or any other lifestyle factors for the median 8 years in between the 2 days of data and follow-up. There's also no way to know if the people practiced intermittent fasting for years or only for a short period of time. People could also have passed away from cardiovascular events due to a slew of other reasons. All these limitations I just listed were actually reported by the original researchers, but ignored by all the media outlets. The research also tries to suggest that intermittent fasting is linked to a loss in lean muscle mass. The fact that their data suggests this would indicate that the people in the study weren't eating well or exercising, because intermittent fasting doesn't cause lean muscle mass loss when you eat adequate amounts of protein and do resistance training. Existing peer-reviewed research indicates added stress from intermittent fasting may raise the short-term risk of heart problems among vulnerable populations, but this isn't a concern for the general population. If you practice intermittent fasting and have any reason to be concerned, do speak to your healthcare provider about it.